And next up, we'll have Sara Koliner from the Department of Health Services.
Hello, thank you for having us. My name is Sara Koliner. I'm the Policy Section Chief in the Office of Policy and Practice Alignment in the Division of Public Health, and I'm joined today with Jamie Olson, who is our Primary Care Program Coordinator. And I know that a question we sometimes get when it comes to the public health division is a surprise, I guess, at the fact that we have the primary care program because it is a more clinical view. And I only ask that you think about the fact that between screenings and prophylactic treatment, chronic disease maintenance, coordination of care, this is really the foundation of promoting and protecting the health and safety of the people of Wisconsin, which is our mission. And so it's actually a really great fit, and I'm excited to tell you what we're doing in that program as well as outside of it today. So I won't go too into the gap because I feel like we pretty much addressed it in the last few minutes, but it's true that we already need to make sure that because this is an essential service that we're meeting access needs to primary care, which also includes dental and mental health care. And there are places where they need it most because of an aging population, where the doctors may not be there for them. And in particular, I see that by 2025, 40 to 50% of populations in 8 Wisconsin counties could be over the age of 65. So this is, in a sense, a geographical problem, which comes back to this idea that we're looking at this afternoon, which is getting the right providers in the right areas. That's part of the issue. And so what we're doing about it is a lot what happens in the Wisconsin primary care program, and a lot of it is centered on establishing these healthcare shortages, identifying where they are. And so I'll go into a little bit more detail about how we designate one type of shortage, but it does feed into the other benefits that we're able to kind of help guide with that identifying of where the shortages are, shortages in primary care access. And so that includes our Conrad 30 program, which is a J1 visa waiver that allows graduates of foreign medical colleges who've done their residencies in Wisconsin to go right into working in Wisconsin communities that need it as opposed to waiting for 2 years. There's also the National Health Service Corps, and even though we don't actually coordinate that program, it does rely on funding that is in part designated by the scores that we receive for the shortages that we have as a recognition of the urgency of those shortages. And so it's important that we are able to identify them so that the places are getting enough money to help programs like this, which help with loan repayment services for providers. We also have the Community Health Center grants, and that's $5.8 million. Sorry, $5.4 million distributed to 18 agencies. And those agencies do have to be receiving some federally designation of being a community health center, and that means having to be in a designated shortage area. So it's all very connected. Um, but because obviously access is an individual issue, we also have the volunteer healthcare provider liability program, and that's really targeted at the providers that are serving our free and charitable clinics. Because sometimes, even if you're in an area that has enough doctors overall, it may not necessarily have enough doctors for everybody. And so we're able to help the providers at those clinics kind of cover their medical insurance costs so that it's easier for them to provide access to services. And so that's inside the primary care program. But outside of it, we also do manage the graduate medical education dollars that were provided through legislation. And I know that we've already talked about that a little bit, but it is another tool in our toolkit that I'm excited to talk about. So there are many different kinds of shortage designations. There's a medically underserved population, there's a health professional shortage area, there's a governor's designated shortage area, and I'm only going to talk about the health professional shortage area, but no, they're all quite different, but still kind of trying to address the same issue. So HIPSA, as I like to call it, is designated for primary care, mental health, and dental health. And that means actually looking at the ratio of either physicians, psychiatrists, or dentists to the population in an area. And once we have that ratio established, we're able to take other information like the Medicaid coverage, the special needs of that population, the cultural needs of that population, the geography, and take that into a bigger picture of what this access to care looks like in this area. So we are really benefited by surveys that are done by the Wisconsin Primary Health Care Association, who look at the FTE and the clinics in an area, as well as demographics such as are they close to retirement age, in order to kind of assess uh, what the provider layout is in an area. And we give that to HRSA, who then combines that with census data and other health information to give a really great picture of whether this area needs more programmatic support. And so once a designation is designated, you also get a score. And that HPSA score is going to help us get some of the benefits to show that not only is this a shortage, but it's an urgent one. And so some of those benefits can be categorized between three large categories, which includes recruitment and retention tools. And so, like I said, that's the loan repayment, where you can have people that work in certain places might get their medical loans repaid. And then the J1 visa waivers. And just to show how high in demand those waivers are, in this last year, we have 30 to give, and in previous years, not all 30 were claimed. In this year, all 30 were claimed in 6 weeks of opening, so it's obviously needed. We can also, by having a shortage area designated with certain scores, retrieve Medicare and Medicaid bonus payments to services by providers in those areas. And clinics in those areas can be designated as a community health center, which we talked about gives them more access to some funds, as well as rural health clinics, which helps expand the services that are provided in those areas. So here's a map of the primary healthcare HPSA. And as I go through the primary mental health and dental HPSAs, I just want to just remark on the fact that these are very different maps because of the colored areas where the HPSAs are. We have to always think about the specific issue. Access to care is important, but it's not well addressed unless we're thinking in terms of the specific care needed. So you'll see that's the mental health care. And then there's dental. So moving on to our graduate medical education topic, I don't want to put too much time onto this except to really just hammer in that this is a very well evidenced tool in order to make sure that we have providers not just coming but staying in Wisconsin. 37% of physicians who complete their education in Wisconsin continue to practice in Wisconsin. 45% who complete their graduate medical education in Wisconsin continue to practice in Wisconsin. People who both do their who graduate from medical school and then do their graduate education in Wisconsin, 71% of them will continue to practice in a setting very similar to where they did their residency, which is really why it's important to have that rural clinic experience for them. And it's what our residents are trying to provide. And so that comes in the form of $2.5 million to support not just new positions, but also entirely new programs across the state of Wisconsin. So in 2017-19, the budget did pass some more training, and this is specifically for the advanced practice clinician training and the allied health professional education and training. And that's because it's important that we also stay innovative and we address modern healthcare innovations to making sure that we can provide access to care in the way that's very efficient and it makes the most use of our resources. And we also added addiction specialties too, I should mention, family practice, psychiatry, and general surgery residencies, because it's important that we also address the priorities that we're facing right now. And so here's a map of our graduate medical education places, and I just wanted to remark on the fact that even though we do have to make sure the programs are housed in a medical college, which is always going to look a little more urban than other parts of Wisconsin, you can see from the colored areas, colored counties where these residencies are established, that it's really allowing new graduate students to go out and experience places where the programs wouldn't necessarily be able to go without this additional support. So to leave you with a few emerging issues, again, the aging workforce, it's another reason why it's important to address this gap, and another reason why it's important to work with partners, and we are excited to work with organizations like WICMU and WHA and our Rural Health Cooperative, because it's allowing us to really get to the problem at all angles in order to make sure that we are going to improve access in any way we can. And another issue that's going to happen is that HRSA is actually standardizing the HPSA process a little bit more, and that's by just relying more on the data that we provide in order to be agile and efficient with identifying where the shortages are. And so that's really allowed us to be creative in looking at new data sources like Medicaid claims to really demonstrate the needs that we have in Wisconsin to make sure they're getting access to those programs that we have. But at the same time, there are some regions that, thanks to all of these tools, are having their shortages addressed. And so, if there's some homework I can give to you today, it would be to think about how are we going to ensure that the regions that address these shortages and are no longer designated as a shortage area can really self-sustain with those provider levels. So thank you for your time, and if you have any other questions, feel free to follow up with us at DHS Primary Care Office at dhs.wisconsin.gov. Thank you.